Good morning. It's Friday, June 12th, so it must be time for another legislative update from your North Carolina Medical Society. And it's been another busy week here at the General Assembly, so I want to give you a few updates. First, the Medicaid transformation bill that we thought would be moving did move this week. It got its first committee hearing. That's Senate Bill 808. And now it's called the Medicaid funding bill. So it does include that go live date for Medicaid transformation and changes it from the original version to July 1, 2021. So that's July 20, 2021 would be the new date as proposed in this new bill version. So we'll be following that bill very closely as it continues to move through the legislative process. Next, I want to point out to you that this week, the House Health Committee brought in Secretary Mandy Cohen to provide them an update on what has been happening with coronavirus and our numbers and where we are currently as a state. There are a lot of questions, a lot of discussion within that committee. If you want to see the summary of that committee and the hearing, please go to our legislative blog and we have all the details on what was discussed and presented there. Next, I want to point out another bill that moved in the Senate Health Care Committee this week and was actually heard twice. So first thing this week, it was heard for discussion only and then came back a second time. And this is the No Patient Left Alone Act. And what it does is it allows any person who's visiting a hospital, any patient, to have one visitor with them during a pandemic or a state of emergency as we move forward. So we heard a lot of compelling presentation both from patients about some of their experiences that they've had during this pandemic, not being able to see their loved ones. So this is a bill we'll be following very closely as it impacts many of our members who work in facilities and the impact that it could have on potentially spreading coronavirus. So that's another bill we'll be closely following through the process as well. Next, finally, I want to point out a bill that was actually an idea that was brought to us on something we needed to advocate for from our membership regarding public health and elections. And we finally saw the bipartisan elections bill we've talked to you a little bit about before get sent to the governor on Thursday. So we'll be following that closely to see if some elections funding can be drawn down from the federal government in that bill language, as well as some other provisions that may help protect public safety in our November elections. There has been a lot going on behind the scenes this week in the legislative session. A number of legislators having ideas, talking about putting those ideas in different bills and different avenues to get them moving. So your lobbying team has been hard at work on a number of other behind the scenes provisions that I won't go into detail about, but just know we're working very hard on your behalf. That is all that I have for you this week. It's been, a very busy week. It's looking like we're getting towards the end of at least wrapping up session for a little bit. Now, that's not to say we won't come back into session at a later date, at another time, again in the summer, but we are getting in that very busy committees happening at the same time, bills moving very quickly process. So stay tuned to see what happens and if we actually get to wrap up session a little bit earlier than we originally thought. It's been great talking to you, and I'm looking forward to updating you again next week.